Shelby Williams with Plano City Council with an update on the situation with the coronavirus pandemic. First, as everyone is probably aware by now, yesterday, Collin County Judge Chris Hill issued a variant of a shelter-in-place order. It's good for 7 days from yesterday, and it covers a few key things. First, if you are sick, stay at home out of public until you have been fever-free for 72 hours and have been isolated for 14 days from the onset of symptoms. This does not preclude you from seeking medical care. Second, if you or any member in your household have tested positive for COVID-19, then stay indoors. Do not go out in public. Again, this does not preclude you from seeking necessary medical attention. Third, while businesses are not explicitly shuttered, people, which includes employees, are ordered to stay indoors except for essential needs. Now, maybe you're essential to the operations of your business, but if you are being asked to go into your place of business just because they like having people around, that's not an essential need. Neither is entertainment an essential need. So there are a few things we can do during this. First, just wash your hands, y'all. Keep your hands clean. Second, respect social responsibility rules and social distancing rules. Remember, the guideline of 6 feet is for indoors. If you happen to be outdoors with somebody and there's any sort of appreciable wind, that 6 foot distance can increase considerably. So just be cognizant of that. And don't pack in with other people like sardines. Now, our small businesses and our restaurants are the hardest hit by this pandemic, the least able to weather this. So please support them, especially the restaurants right now. They depend on people coming to their establishment. Countless restaurants have adapted to this situation by offering takeout and delivery. Please make use of that. The grocery stores, they had a sudden windfall of everybody buying everything all at once. The restaurants did not. So please utilize them. Please get some food and support them for takeout or delivery. Now, on that note, I do want to caution people, please do not hoard things. The only reason there are stockouts on the shelves right now is because everybody bought everything all at once. Demand for things such as masks, hand sanitizers, soap, toilet paper, tissues, etc., production of that stuff is still going. Supply lines are still intact. They are producing these things in greater quantity to meet the current demand. But it takes time to resupply those shelves. The distribution chain is meant for a steady stream of consumption and to restock those things regularly, not for a sudden run on those goods. So please do not hoard. The supply lines are still functioning. Let them function. Now, in addition to supporting your local restaurants and small businesses, there's something I'm very excited to say I've been working on since this weekend. Government is not made, nor should it be made, to cater to everybody's needs at a micro level during a global situation such as this. To that end, countless people and businesses have risen to the occasion. You've seen them on Nextdoor, on Facebook, and other mediums offering to help. This is phenomenal, and it's amazingly encouraging. However, these groups of people and these individuals lack a couple of things. They lack necessary technological tools to facilitate this kind of community response. They also, in many cases, lack the volunteer organization capability and experience to facilitate this. To that end, based on a conversation I had with a constituent, Noah Skosilich, last Friday, and Noah is probably on the opposite end of the political spectrum than I am, but we agree on one thing, if not more. But that one thing is the need for greater citizen engagement. So Noah and I talked on Friday, and over the weekend, since the weekend, I've been in a flurry of conversations with Microsoft, with a local volunteer organization, a company called VOMO, and others, including Catholic Charities USA. Now, what we're looking at is something that I hope will be available this week for mass consumption for free. Microsoft is making their Teams platform capable for free during this. VOMO is making their volunteer organization platform free during this. They're being tremendous corporate citizens. Catholic Charities USA's disaster operations team is advising us with approaches to take during a disaster, during a humanitarian relief effort such as this. Now, I'm terming what we're building toward as a community pandemic response team in a box. So what I'm looking at producing within the next few days, hopefully this week, is a quick start kit to connect you with essential technology, anybody, anywhere, across the country or across Western civilization, a kit to enable you to access critical technologies to facilitate these needs, understanding who needs what and who can meet those needs safely and securely, as well as a 1 to 2 page document telling you how to leverage that technology and how to organize your team. It's coming together very rapidly, and this will enable people anywhere across the country to set up an organization on the fly in response to this in their neighborhood, in their part of town. And it's not going to be perfect because no platform has ever been built for this. And no wonder, because global citizen enablement for pandemic response has never been a value proposition that anybody's ever explored until now. Well, we're moving on the fly, but it requires a couple of caveats. First, always respect the local restrictions that are in place, whether you're in California, whether you're in Collin County, Dallas County, anywhere across the country or the world. Make sure you respect the local restrictions in place right now. To that end, please make sure that local law enforcement and the local authorities know what you are doing. They don't have to be involved at the micro level. They don't have to know what you're doing with each person who has a need, but just let them know that you are setting up this team of volunteers to respond. And just make sure they're in the know and there are no surprises. Now, this is also developing extremely rapidly. The folks at Microsoft and at Vomo are adding new capabilities and evaluating what they can do to assist in this every minute. And daily capabilities are being added. So when this is released as really a cobbled together toolkit, recognize that it will change daily to create greater enablement and greater tools so that we can all step up to respond to this need. So I want to thank everybody involved in this, and I will, of course, promote this instantly when it is put together and available. We just want to make sure that we're at the point where this solution is not counterproductive because it wasn't made for this, but we are adapting it in real time. Now, all that said, I want to assure everybody of a few things. First, many people are looking at the latest mortality rates, the latest figures. More people are going to get tested. We are going to hear about more people that are testing positive. This is a good thing because it means testing is more widely available, whereas it wasn't previously. Now, the mortality rates are all over the map, depending on the country and the locale within a country. Italy has been the hardest hit at the latest figures I looked, with a mortality rate of over 8%. The global average is around 4%. The US average is just under 1%, I believe, currently. But it's important to understand that's out of people who have tested positive. That number can only come down as more people test positive who have not succumbed to this to a fatal extent. That mortality rate will come down. That said, it's still looking around an order of magnitude greater than the flu. Your run-of-the-mill flu does cause a number of deaths each year worldwide, but it's at a 0.1% rate. We're looking at around a 1% rate after we factor in all the people who have COVID-19 but have not yet been tested. So that's 10 times deadlier than the flu. So again, take necessary precautions, practice social responsibility, wash your hands. And it's important to understand that the reason for all of this is not the mortality rate. There are a number of pandemics which have a much higher mortality rate and are much deadlier. The most concerning thing about coronavirus isn't the mortality rate, it's the fact that it spreads so easily and so silently. Now, the people at most risk are those who are senior citizens or who have underlying health conditions. So If you fall into one of those categories, please keep yourself isolated, not necessarily for the benefit of anybody else, but for your benefit. You are particularly susceptible to this. All of the mortality rate numbers, or most of the mortality rate numbers that we're seeing, are coming from those categories, senior citizens and those with underlying health conditions. So please keep yourself isolated and use whatever electronic medium you have to reach out and communicate your needs to those you trust. Friends, family, neighbors, church groups, etc. If you've got needs, they can be met by your friends and family safely. Just please make sure you're communicating that. For everybody else, please practice social responsibility. Don't panic. I'm going to take a page out of Douglas Adams' book here. Just don't panic. Exercise proper precautions, and we will get through this. Now, different countries are implementing different models. Denmark is doing the exact opposite of what many countries are doing with strict isolation. Denmark is trying to develop herd immunity by sheltering the people who are most susceptible to issues from COVID-19 and letting everybody else get over it. It'll be interesting to see which models prove which success rates, but in the meantime, we state by state have set a direction, and we need to honor that. Recognize that especially in a state like Texas, the geographic distribution of so wide an area, the needs are very different. You know, downtown Dallas has very different needs than a rural community an hour outside of Lubbock. Okay, so that's got to be modeled on a community by community and a county by county basis. The response has to be modeled. So that's it for now. Please be on the lookout for this community coronavirus response team in a box capability. I will keep you updated on it, and we will make it as easy as possible to use. Thank you, everybody, for stepping up in this. Thank you for looking out for one another, and God bless. I'm Shelby Williams with Plano City Council.